Hello, my name is Kelly Fields. I'm an RN at Tucson Medical Center on the Labor and Delivery Unit. For my concept application project, I have chosen to focus on the patient-centered care model. The patient-centered care model is part of a microsystem about placing the patient at the center of the team. A team made up of the patient, family, nurses, physicians, and ancillary staff involved. This team collaboratively decides on the final plan of care, but patients have a high respected input when this plan of care is made. The labor and delivery unit I work on operates on a patient-centered care model. One aspect that is paramount of the patient-centered care model I work is education. The model is comprised of 4 core concepts: value of patient preferences, education of suitable evidence based on options available, support of patients' personal and cultural values, and a partnership between the patient, healthcare providers, and family members involved, if applicable. The patient-centered care model was established to put the focus on where it needs to be, the patient. Many aspects are involved in this patient-centered care model. Leadership. Leadership in a patient-centered care model should produce a perception of safety and confidence. Clinical nurse leaders, management, directors should support, inspire, respect, and defend their nurses. They should focus on achieving effective communication with staff and encourage an open forum to voice opinions. Leadership pertains to the microsystem with the proper guidance of staff and their resulting performance. A successful leader in the patient care model does not solely rely on the budget defined by the hospital, motivates nurses to perform with their maximum potential, understands that nurses originate with excellent leaders. Bedside nurses cannot base their care in a budget on where we stand on productivity. This is unsafe and could have detrimental effects on patient safety. Leadership should educate, assist, and listen to staff members. The organized culture and support. For organized culture, there must be a sense of camaraderie within the staff. A team working together to accomplish a common goal of safe patient care is more effective than 10 to 12 nurses trying to achieve that same goal. The camaraderie can be nurtured by management. In the opposite, the same team can be brought down if the organization does not support or endorse their nurses. Inadequate staffing can also bring down camaraderie and directly impact patient care in a negative way. Organizational support. Adequate staffing of a unit is essential to maintaining the camaraderie and staff satisfaction. Actively listening and aiming to meet staff requests are also essential to further a functioning team and satisfaction. Some key points are adequate staffing and ancillary support, high staff morale, strong teamwork, management that meets with staff privately and confidentially on a needed basis. Staff meetings are held that have an open forum for concerns and discussion opportunity. Answering other staff members' call lights, switching out a bag of lactated ringers, and charting it, bringing the patient a cup of ice can be done by any nurse in the nurse's station, as opposed to telling the assigned nurse that their patient called out and needs something. Open staff meetings where a nurse can speak up about problems, hindrances to job satisfaction, need to truly be heard. Patient focus and staff focus. Patient focus. The care delivered on the labor and delivery unit is centered around the patient. An integral part of patient focus is the use of continuity of care. Fragmented care can have an effect on safety and patient satisfaction. Staff focus. In order to have this stability function properly, the leaders of the unit must also share a sense of magnitude regarding patient care and safe outcomes. Communication must be clear about recent assignments. Patient assignments must be appropriate for the nurse. Patient satisfaction has been proven to be increased with less fragmented assignments. For example, patients having multiple nurses during one shift. Continuity of care reduces the chances of lost or missed information, whether it be vital or not, whether it be medical or social. One example is not giving a complex assignment to a new grad nurse that is not suitable. This is an aspect that could be improved on my unit. By choosing our assignment, we can make our charge nurse aware if we have taken care of a patient and feel comfortable taking care of that patient. As of recently, the change has been made that the staff do not take part in choosing assignments. They are simply given to us. The interdependence of a care team in a patient-centered care model. The joint efforts of respect and confidence in a multidisciplinary team to acknowledge each staff member's role are vital in achieving the goal of a patient's safe outcome. The future workforce of healthcare has the vision that success will result from interdisciplinary collaboration opposed to segregation of their practice. Key points of this are staff acknowledgement, collaboration between levels of the team, and a vision of success and common goals of patient safety. This is an area I feel we can benefit from in my unit. There's a definite lack of respect that trickles down from higher from our manager, down to our director, down to our manager, down to us. The delivery of information is done in a condescending tone, as if we are incompetent nurses. The use of information in healthcare technology. The use of electronic record keeping is a valuable way not only to reduce errors, but to save time when delivering safe patient care. Having bedside charting stations also helps safe charting and medication administration. To be able to obtain medication doses, imaging, and test results at the bedside can save time and decrease errors. The health information technology that we use are barcoded patient identifying bracelets, bedside charting stations. At the bedside, we can easily locate lab and other test results, scanned media from outside sources. The HIT is remarkable at Tucson Medical Center. We have answers to questions regarding imaging, progress notes, H&Ps, lab values, home medications, medications ordered during hospitalization, and medications the patient has received. Our bedside charting stations have linked barcode scanners to the medication administration record and the patient's wristband. Pharmacy calls and alerts us if the medications taken and medications ordered have an adverse effect before we are able to administer it. Process for healthcare delivery improvement. Process improvement is an activity that should be performed daily. It is comprised of analyzing and assessing the process at hand to improve patient care. Patient-centered care is improved when positive leadership is present. Some key points are leadership support, frequent analysis of the microsystem, positive delivery of information regarding unit news or changes. Staff performance patterns. To find staff performance, the data collected from staff and ancillary staff feedback needs to be assessed. Staff is questioned about possible needs for change. They are asked to provide possible solutions regarding glitches or hindrances in providing safe patient care. Changes then are implemented if an appropriate solution is discovered. Some key points. Our clinical leader is the first in our chain of command. Next is our manager, then director, then house supervisor. Staff evaluations are done at the end of the year with a competency list given at the beginning of the year. Evaluations and competency lists always include some form of continuing and furthering education. We have 2 clinical nurse leads that operate on very different modes. Some days we walk into our unit and cringe when we see who's in charge for the next 12 hours of our day. Feedback regarding problems with a certain CNL is ongoing. We have moved up the ladder with letters and meetings to the director with none of the change that was promised. Leadership. The leadership on my unit can affect staff morale and consequently affect patient care and safety. Communication can be a problem as we are told what is needed to be done in a demeaning tone. We are a group of very strong nurses with hundreds of cumulative years of clinical experience. We are a genuine team, and when a task needs to be done in an emergency, it gets done. Some key points about leadership is spoken appreciation, safe assignments, adequate staffing, many more. For example, in an emergent situation after a hard day, we all thank each other, sometimes even use social media to do so. We very rarely hear "good job" or "thank you for your hard work" during Kelly's massive hemorrhage or seizing patient or neonatal resuscitation from our management. This can affect patient safety if we get frustrated. The clinical nurse lead should be in the room during these situations, but anesthesia is the first one who shows up. When we are not appreciated for hard work, the individual mood of staff members is negative. Leading the plan for healthcare delivery improvement. As our clinical leaders, all of our clinical leaders and our manager were once bedside nurses in labor and delivery. One approach for them to understand their lack of gratitude is if they were to spend a shift on the floor with a complex assignment. Another shift, they could have a doubled assignment and see how demanding it can be. Sometimes these paired assignments are feasible on paper, but to spend 1 hour with each of them, it becomes apparent that they need to be one-on-one. Some patients do not get proper assessment until an hour into a shift because the other patient requires so much attention. I believe that they would step back and have appreciation for what we do to provide safe patient care on a daily basis. I think the CNO and manager should step into our roles for a shift with a focus on considering if they can provide safe patient care in our given atmosphere. Reevaluate the safety of some burdensome assignments and possible impact of poor outcomes. I am made fully aware almost daily that we are understaffed, but that cannot impact our care of our patients, just as we are not in charge of hiring staff. Budget cannot be brought up as an issue as to why we do not have adequate staffing on the floor. Thank you for listening to my presentation, and I hope you enjoyed it.